Hi there, I'm Shawna Robins, founder and CEO of Third Spark, and today I have the pleasure of doing an Authority Magazine interview with Angela Johnson. Angela is the CEO and co-founder of sanoLiving, Canada's only fully national digital health platform for women's midlife care. And she draws on her experience as the founder of Medical Confidence and former IBM leader on how to redefine women who need to receive healthcare services, addressing a long overlooked gap in midlife care. Hi, Angela. Thank you for joining me.
Thanks for having me.
Can you tell me how you got started here in the health and wellness field?
Well, um, at IBM, we definitely did health and wellness. Always had an interest in there, and I loved what we were doing with AI back then in with Watson. But where I really stepped out of it was when my sister was dealing with her own personal health issues and navigating the healthcare system in Canada, which, a lot of Americans have family or friends that are in Canada and they hear how hard it is. The public system, well, it's great if you have, you're in a life and death situation and you've rolled up in an ambulance, but if you're what they call elective care, it can be really, really tough. And so helped her, and then that got a bee in my bonnet. And when I get bees in my bonnet, I pick up myself and I say, I'm going to solve the problem. So we actually were able to reduce wait times in Canada by 220 days. And
Mm,
you go, wow, that's a long time to wait. Well,
yes.
yeah, it's insane. And it's only gotten worse with COVID up here. And so then I sold that company and I took a year off. And when I did, I thought, oh, I'm not working. I'm postmenopausal. I don't need my hormone therapy anymore. And I quit cold turkey. And that was a really big mistake. And so I suffered from perimenopause. I had immense night sweats. Didn't put the two and two together until I found a gynecologist that was helping with some other concerns that I had at the time. But so it helped me get on hormone therapy, and so I soared. My career just took off, and I did really well in my personal life and my professional life. And then when I went off my hormone therapy thinking I was done, it was a big eye opener for me. Not only like I never had hot flashes, but I was having one every 30 minutes. I had depression. I had tinnitus. I was getting sodium hyaluronate and cortisol injections in my knees because of joint pain. And as soon as I went back on my hormone therapy, that all went away. And I felt like, like a rock star again, and then I could do anything. And so when it was actually my husband that recommended that I pick up the sword again, and I explored what was going on in the world. And the UK had been at this for 10 years, having solutions like what we do, where, in workplace benefits, over 50% of employers have a solution like this, where women actually have access to care.
Mm,
And here in Canada, the last couple of years, it's been very focused on policies. And I see it in the States as well, as let's create a policy in our workplace around women's periods and menopause. And let's create accommodations for them. And while a fan and cool rooms and control of a temperature gauge might be nice, it really isn't solving women's challenges. And at a time when we're supposed to be earning our, highest income opportunities because of our experience and, the opportunity of leadership roles or overtime on the plant floor and getting time and a half or whatever that is for your career, it hits us at that moment. And most of us find ourselves having to take steps back as opposed to leap in and take those opportunities that are available to us. And the last thing I want is women to be labeled with more stigma around aging out. And we're actually at a point in our careers where we have this immense knowledge, immense expertise, and actually, our brains, as Lisa Mosconi in her research down in New York is teaching us, is that women's brains change as we age and into postmenopause, where we actually tap into our empathy centers and our leadership. And so the workforce is losing out on those things, but women are losing the opportunity to really accumulate their own net worth so that they can live the lives that they've envisioned for themselves
mm,
after their careers.
mm. Wow. Okay. I can't wait to hear about what you offer for employers. So tell me a little bit about sanoLiving and what the platform is and what the benefits are for employers and employees.
Yeah, so it's a full comprehensive solution. So there's a technology component that self-guides women to assess their symptoms from their periods all the way through, estrogen receptors are everywhere in our bodies. So most of us don't put two and two symptoms together because they don't make sense. But it is that the estrogens or receptors are everywhere. So it helps them assess their symptoms and then gives them what stage of menopause they're in, and then tools and tips around how to manage those symptoms, and then connects them directly with a coach who is a licensed practitioner, either a nurse, a social services worker, a psychotherapist, a dietitian, depending on what symptoms they have and what they want to focus on. And then that coach works with them till they decide that they don't need a coach anymore. And they focus on the lifestyle components, helping them understand the interventions that they can implement to address symptoms, but also live a life without chronic illness. So, women have been given the gift of longevity, our generations, right? So, depending on our life choices, we can live an immensely long, fulfilling life of great health span, or it can be riddled full of chronic illness. And so that coach is there to help us understand all that, learn, because the more educated and informed we are, the more we engage and we start to implement those good lifestyle habits and choices. And so they're there to support from that perspective. They also get paired with a clinician who can prescribe, or if they choose to go the more natural route, they get paired with a naturopathic doctor. Some have the ability to prescribe, some don't. It depends on what region they live in. But that team is their sort of clinician team that works with them throughout the year and supports them. And if they continue and renew, because menopause doesn't just last 1 year, it's multiple years, right? It's a life stage, and doesn't stop.
So, what are you seeing as far as retention and support women that are able to access what you offer where their employer provides this? I would think that if it were me and I was in a workplace where I felt seen and heard and I was given resources like what you offer, my retention level would be through the roof. Why would I want to work anyplace else? Even if the job was something that maybe I'd been doing for a long time or that I was thinking of shifting or moving out of, I would think that this would be such an immensely important benefit for employees. And I can see women being very loyal when they're offered, these types of solutions in the workplace.
For sure. So when women come in, they do that initial assessment. And then once they are in their care plan and working with their clinical team, they actually reassess after 2 months and then again 4 and 6. And what we see is women are reporting for severe symptoms, 87% report significant improvement within
Wow.
just 2 months.
Wow.
And then for moderate symptoms, they're reporting 60% improvement. It's significant, right? It is mind blowing. And so when employers really look at the data and reflect, a lot of the absences they have in women that are in this age group are in the categories of anxiety, depression, sleep disorders, fibromyalgia, chronic pain, all common symptoms of menopause.
Mhm.
And in fact, insurers, if you look at insurers data and claims data, they say for every man that goes on an absence for mental health, 2 women do. And the average age of that claim, 45. That's perimenopause.
Mhm.
So for employers that implement solutions like this, they have employees that are at work and stay at work and are engaged and productive. And so it's really important that employers offer these types of services. When we look at who uses our program, 96% of the individuals that opt in to use the programs actually have full coverage. 4% are having to pay out of pocket.
Hmm.
So, women want it to be fully covered, right?
Yeah.
They want access to the care. And paying out of pocket is really hard for them to do, right? Women will always prioritize the household expenses over their own needs.
Of course. And especially with long wait times like that in Canada
Yeah.
to just see a doctor. I mean, I know in the United States, I went to 5 different doctors before I found hormone replacement. Every doctor offered me something other than hormone replacement when I was 47. Do you want birth control pills? Do you want antidepressants? Do you want, like, I mean, you name it, right? But not hormone replacement. And
So
so the fact that you have the ability to offer all these things to women, cut down the wait time, lower the barriers of entry, and have it done in their workplace where it's covered. I mean, this is like the dream come true.
yeah, exactly. It is. It is. I firmly believe that we need more of this. And if women want to share they're going through menopause, that's their choice, but they shouldn't, we shouldn't have to make it that they have to choose to go in and tell their manager, I'm going through this, so I need an accommodation because, there's a stigma attached to that. And a lot of women are afraid to have that conversation. And, we fought long and hard to have the opportunity to have equal, you know, choice in the employment world and, trying to get those leadership positions or the extra time on the plant floor. The last thing we need is, to be labeled of, she's aged out and we need to find somebody else.
Or in some way your body is not high functioning, or your brain is not high functioning, or you're broken in some way at this stage
That's
in the
right.
game. Yeah, yeah, there's huge amounts of, I think, labeling and shame like you talk about that are really important as a society that we get through. And so giving women language to be able to, get the help that they need in a way that doesn't sacrifice what's important to them, whether that's their career, whether that's their standing in their community, whatever that is, right?
Yeah.
Yeah. Even just the way you feel about your own self. I mean, I felt so incapable for those 3 years until I could find, like you, find help and find somebody a practitioner that could see me and work with me. It was really a challenging time during perimenopause.
It's so true because our confidence gets waffled. And when our confidence is waffled, we're not able to take advantage of those unique strengths that we have at this age. And so we become our own sort of negative Nellies and it just compounds itself, right? Like it really does get harder and harder to get out of that. So having a team to help you address those things and find your inner what I call badass. Um, we all have it. And finding that confidence again, it totally shifts your paradigm as soon as you do.
Hmm. Great. And that'll shift it on not only a community level, but a level that's much larger than just,
Yeah. Yeah. I mean, it's not just a woman's issue and it's not just a family issue. It's an economic issue. It's a human issue, right? So we just need, it's not real hard rocket science. It's very easy to fix, right? So
yep. People caring about people. That's what this is. All right. So tell me how people can find your company, both in Canada and the US. I think you mentioned you have a US office. Tell me about
yeah, so we're just in the midst of expanding to the US. But if you go to sanoliving.ai, you can get access to us. And from there, you just click join and you're in.
Amazing. All right. Thank you so much. I really appreciate you taking the time to spend with me today, Angela. And thank you for doing all that you're doing to help elevate women.
Thank you.